Good morning, good evening, good afternoon. This is Dr. Garais, BIO117, Laboratory, Unit 3, Week 3. We're doing genitourinary systems, so it's both renal and sexual organs. So this first is done, of course, we isolated from our female Asian patient or Asian cadaver. And this is the simple view. You have, of course, kidneys, ureters, right and a left, urinary bladder, and urethra. And you know this is a short urethra, therefore this is a female anatomy. Now, that's easy. Now, what would be more challenging is, if we're talking about renal, and let's look at this. Of course, the outer layer here is the cortex. The inner layer that has all the pyramids, renal calyces, and the renal pelvis here, that is your medullary area. So, of course, you have here, 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 those are renal pyramids. All the tissue in between, or the meat of it all, that's called the parenchyma in anatomy and physiology, like the structures of the meat in between, those are your columns. And if you look really close here, see this little triangle right there, right? That's your minor calyx going into a major calyx, and then this area here where there's the hilum, where it indents, that is your renal pelvis. Okay, maybe we'll have a better specimen for the male. Okay. Next one, of course, is what we did yesterday, is the female reproductive anatomy. Now, if you see here, this is the entire broad ligament. We didn't remove it yet. Do you see how it covers the uterus, the ovaries, and the fallopian tubes? And this is on the other side. This is the left side of our patient. Okay? Because if we're looking at this anatomically, this is front, behind this is back, and of course this is left and this is right. Now, let's remove it. Of course, using this tool, Explore tool. Then this button, then I'll remove that, and then now you will notice the similar coloration of this smooth muscle here, of the uterus and the vaginal canal. And if you look at it this way, again, uterus and the vaginal canal. And where the uterus and the vaginal canal meet, right here, that is, of course, your cervix. The other major structures are, you look this way, your ovaries, fallopian tubes, this area here where it kind of funnels out, that's your infundibulum, and inside those are the finger-like projections called your fimbriae. Looking at the external structures of the vaginal introitus, or the outside, you have your labia minora, the smaller doors, and the smaller lips. Labia means also lips. And the labia majora, which is here. And I will highlight this. This is your clitoris here, the base of it, and then the male erectile tissue here, which is the homologue of the male penis, is located there underneath the labia minora. Okay, now those are all the major structures. Let's now look at all the ligaments. Now remember, the key to the ligaments is they're colored kind of like the same as bone. And you could see this one right up here, that's your suspensory, because right here are your ovaries. Your suspensory are connected to your ovaries, and it's going to suspend or hold up your ovaries. You have this one right here, both, of course, left and right. Let's see if it'll click on. Hold up. Oh, having some technical difficulty. All right, I click on this. Okay, well, see this here? That's your round ligament. Maybe we'll click on the other side. There you go. And that's your round ligament supporting all around. Cardinal ligament supports the vaginal canal here, laterally on left and the right. If you look behind the vaginal canal, and also near the area of the cervix, you have your uterosacral ligaments. And then, of course, in the front, your pubovesical. Okay. So to recap, suspensory ligament, round ligament. This one right here is your cardinal. The ones in the back, uterosacral. And these ones right here, let's highlight them and maybe look at them this way. The ones right here, right, that is your pubovesical. Okay? And that covers all the parts you need to know for the female reproductive. And let's go last but not least, male reproductive. Let's look at male renal first. Let's cut this up. Not much better. Let's cut the other one up. Maybe it'll be better. A little bit. We see here, of course, the cortex and then the inner medullary area, renal pyramid, columns to its side. But do we see here? See right here? Minor calyx going into a major calyx. And this big area right here is renal pelvis. Then, of course, gets everything into the ureter on down. So let's trace the ureter. And the best way to look at male repro, I like looking at it from the side view like this, because I can easily now trace the ureters into this, of course, our urinary bladder, right? Inferiorly, because of course this is superior, this is inferior, right? A little bit upside down. You have your prostate gland and your seminal vesicle. You could see and trace back your seminal vesicle. This is your vas deferens, also known as your ductus deferens. That's where we do the vasectomy. Then connects here to this area right here before the testes. That's your epididymis, and that is the maturation area for the sperm. And then, of course, the production of the sperm is, of course, your testes. Okay. So let's trace back. Testes, epididymis, then your ductus deferens, also known as your vas deferens, goes all the way up and around, connects into your seminal vesicle, then your prostate. And underneath all of that, that's of course your male urethra. And it's right there. It goes underneath all of that. So there's tubing going into here, of course, because this is the penis, is the delivery vehicle for not only sperm, which of course goes through here, but urine, which then goes through here. The urethra is in this area right here, which is the corpus spongiosum, which is the inferior or underneath side. This is the glans penis. And then, of course, if our patient had foreskin, that was called the prepuce. That would be over, over top of this. And then you have the two sets of erectile tissue, which is here and here, and that is your corpus cavernosa. That is the erectile tissue that, if the parasympathetic nervous system activates it, you will have, or your patient will have an erection. Now notice that the corpus cavernosa, right, that is the erectile tissue. This area right here, the spongiosum, is not erectile tissue in the same way as the corpus cavernosa. The corpus spongiosum, think urethra, and you could see a little bit of it here. Okay. All right, and that concludes Unit 3. BIO117 Laboratory, Anatomy and Physiology 2. All right, good luck on your exams.